I'm your host, Neil Howard, here on Health Professional Radio. Thank you for joining us. We're going to be speaking with Dr. Scott Sigman, founder and CMO of OrthoLazer and team physician at UMASS Lowell. He's joining us to talk about the publication of a second case report demonstrating positive outcomes for a COVID-19 patient treated with adjunct laser therapy. Welcome to Health Professional Radio, Dr. Scott Sigman.
What a pleasure to be here. Thank you for having me on.
Well, above your position of your being founder and CMO of OrthoLazer, give our listeners a bit of your background and talk about how you came to be at OrthoLazer.
Terrific. So I like to describe myself as the original opioid-sparing orthopedic surgeon, healer of knees and shoulders left and right, social media influencer, #FollowPro, and also host of the Ortho Show podcast. I have always been a big proponent of opioid-sparing surgical intervention, changing the paradigm of postoperative pain management given the high addictive potential of opioids. And that's how I got moved into the laser world. We were using laser as an alternative treatment option for acute and chronic pain with a laser that is FDA-cleared since 2011, which is the MLS laser technology. And it came to my brain one day that we were seeing profound improvement with the laser for acute orthopedic injuries. And then I said to myself, what is COVID? COVID is really acute inflammation of the lung that has gone haywire. Wouldn't it be neat if we could trial the laser for acute COVID and see if we'd be able to add a supportive treatment option for patients with acute COVID disease?
So that's how you came to treat the patient that we're going to talk about today.
That's correct. It was not an easy proposition, to be perfectly honest. I had to go to the institutional review board at my hospital, and they liked the idea, but they had no idea about what laser was or how it would be used, and they said they needed FDA guidance to be able to proceed. So, sure, why not? I just picked up the phone and called the FDA, and believe it or not, in the midst of the pandemic, most of the regulatory barriers had really dropped, and someone called me back within 6 hours. I relayed the specs of our laser to them. They realized it was FDA cleared previously. They reviewed everything, and over a 5-day window, they got back to us to say that we had a non-significant risk device, which basically gave the clearance for the use of the laser for acute COVID at my hospital, which is Lowell General Hospital, just north of Boston. Unfortunately, that still wasn't really good enough for me to figure out what to do. As I've stated, I'm an orthopedic surgeon, and I was the principal investigator of a pulmonary study for laser. I needed help, and so I wasn't sure what the correct dosage was, and I went to the Google machine and really just put in COVID and laser therapy. And fortunately, 2 doctors, Sohila Mahmouli and Mariana Petrizzi, who are MD PhDs from Canada, had experience with the use of laser for pulmonary conditions, but had also just written the paper on the hypothetical use of laser for COVID. So it was pure serendipity, but I was able to partner with them and get the correct dosage, which allowed us to start the study.
What level of infection or I guess symptoms must a person be experiencing to be considered for this study?
The inclusion criteria for the study, this was a limited study. It was only 10 patients, 5 in the treatment group and 5 in the control. But basically, these were patients that had to have been positive COVID, identified by virus scanning, PCR testing, and then they had to have oxygen support, and they basically needed to be able to self-prone. They needed to be able to get into the prone position so we could allow for treatment. The patient specifically, the case that we're talking about today, was a severely ill woman. She was 32 years old. She's morbidly obese, history of asthma, all of which are very negative prognostic indicators for someone with disease. Mm-hmm. She had significant pulmonary disease on her chest X-ray with ground glass opacities covering both lungs, and she was on high oxygenation needs on the floor and had just been evaluated by the intensive care unit for the possibility of mechanical ventilation. So this was a very sick individual that we used in this case report in particular.
So how was the laser used and on this patient with COVID-19?
So we have the patient go into the prone position specifically because that allows us to get most of the stuff out of the way so the laser can penetrate. So for those that are not familiar with laser, ours is a pulse laser. It doesn't generate heat energy more than about 3 degrees Celsius. It penetrates below the skin about 5 to 6 centimeters. So we need to get through the chest wall to get to the lung tissue. So we have the patient lie in the prone position with her hands underneath their head. This allows for the scapula, the wing bone, to swing out of the way, which decreases the size of the chest wall. They then lay there for 14 minutes per side. So we do both lung fields. So it's a total of a 28-minute treatment. And what's quite remarkable, and I was there for each patient, we all donned our PPE, and I donated the laser for this study, so there was no financial incentive. And basically, we just watched these patients, and they literally would improve in their clinical condition as the laser was happening. Some of the negative energy we've had is that, well, it's because they were in the prone position, that's why. But the studies clearly show you need to be in the prone position 10 to 16 hours to generate improved oxygenation. We were seeing it before our eyes where the oxygen levels were going from 90% to 100%. And literally, we did this once a day, daily, for 4 consecutive days. This patient's chest x-ray, as you can see on the report, went from ground glass opacities to near clear. Also, remarkably, interleukin-6, which is one of the cytokines that we can evaluate for the level of inflammation or sickness of an individual, was very high for her. And basically, after the 4 treatments, hers went down into the normal range. So we have chest x-ray improvement, we have outcomes that are improved for the patient clinically, and we have a chest x-ray that improved. And this is a woman that was near teetering on intubation in the hospital, who basically was discharged home the day after her treatments, and she's been asymptomatic since and is happy and very, very pleased to be alive, to be perfectly blunt.
Now, other than the position of the patient, why do lasers work, particularly in COVID-19? Why does it work?
Great question. So I always like to start off with photosynthesis, because that's something that we all can recognize, and we see it every day, right? So we know that sunlight comes down and it affects trees and plants and vegetables, and we can watch them grow in front of our eyes. If there is no sunlight, that will not happen. So that's a very well-established scientific fact. So it should come as no surprise to people as a human species living on a planet with the sun that in our deepest genetic code, we would be sensitive to light as well. And so what happens is, if you go all the way back to your high school days, and if you remember the mitochondria and the Krebs cycle, and there's these enzymes that generate energy for the cell. And what happens is those enzymes in particular are sensitive to the light waves that we're using, which is 808 and 905 in particular, which is near infrared laser. You can't see it because it's out of the visible light range. But those enzymes can then get excited. You hypermetabolize the cell. And then what happens is the sort of cells are in the state of inflammation. And we know what these cytokines are. Cytokines are these proteins that get made in the setting of inflammation. Some of them are pro-inflammatory, and some of them are anti-inflammatory. So what happens is the laser helps to block the cytokine storm by creating anti-inflammatory proteins or cytokines. And that basic science has also been very well demonstrated, certainly in the animal model as well as at the biologic level for cellular level as well. The clinical studies are still lagging, but they are being generated on a daily basis, where we're seeing now and hearing about laser studies for pulmonary condition and COVID, in particular, across the world, in Russia, in Australia, in Brazil. And these studies are hopefully going to be published, shortly as well. So there's really good understanding as to how laser works. And what's really remarkable, Neil, is that if you think like remdesivir just got approved, yesterday by the FDA, it's a drug, and drugs have potentials for complications and other issues. For this, it's light. We plug it in, okay? You can't hear it, feel it, or see it. This laser has been around since 2011 for musculoskeletal conditions. There's no reported complications. It doesn't burn the skin. So there's no great risk to the patient, and there's a tremendous potential gain in having a viable treatment option that you can plug into the wall that doesn't have side effects. That really is quite profound, and I really appreciate the opportunity to be on with you today, because really our message and what we're trying to accomplish is to get an academic institution to run a larger clinical trial so that we can generate more evidence that laser is a good option as supportive therapy for COVID.
Well, Scott, would you give our listeners some online resources where we can learn more?
Absolutely, Neil. So you can find information through our website, which is www.ortholazer.com. That's OrthoLazer.com. In addition, you can find more information specifically about the MLS laser through celasers.com. That's CELASERS.com. And for those that really want to dive deep into understanding how laser works for COVID, there's a wonderful site called ResearchGate, which is very similar to LinkedIn and Facebook for researchers around the world. You can plug in basically a search for laser and COVID, and you can really dive deep into the technology and the research.
Scott, I appreciate you joining us here on Health Professional Radio this morning. I hope we can speak again.
Oh, it was my pleasure, Neil. Thank you so much for the opportunity.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Scott Sigman. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.